Good afternoon. I'm talking about biopsychosocial review to obesity, health psychology, Kaiser University. Dr. Lisa Fox is my instructor, and I'm Diana Cross, a student, and today is February 26, 2017. Biopsychosocial model of obesity consists of the introduction, obesity, psychological component, biological component, social element, biopsychosocial model, intervention and prevention, lifestyle changes, conclusion, and reference. So we will begin with the introduction, the complications of obesity, and statistics. Several methods are used to measure human body fat. One way is by calculating the body mass index. Studies according to the World Health Organization, National Institute of Health, and the National Heart and Lung and Blood Institute concludes obesity as BMI is greater than 30% kgm2. Studies also conclude that based on a survey, people aged from 49 to 50 were 40% overweight. African Americans are 53% overweight. Mexican Americans, particularly women, were 51% overweight compared to European Americans at 39%, which indicate probable health disparities between ethnic groups is alarming and thus growing worldwide, according to the Center of Disease Control and Prevention. The effects of obesity outcomes. Obesity outcomes affects adults in an alarming rate, starting with poor eating habits of foods with high caloric intake as well as supersized, low-cost fast food intake. Obesity is linked to several diseases such as cardiovascular, type 2 diabetes mellitus, hypertension, cancer, osteoarthritis, and inactivity. According to UK National Audit Office estimate obesity cost an amount of $480 million in health risk factors of obesity. In addition to review systematic treatment for obesity, therapy is significant to impact complete goals of weight reduction as well as modifying the behavior from achievable outcomes. The biopsychosocial model. As you can see, there's 3 cycles of biological, psychological, and obesity. A question of concern is, why diets fail? People living with obesity has many physical limitations and also inhabits psychological burdens such as depression, shame, and often low self-esteem as well as lack of social interaction. This may cause them to eat more. Studies have shown the prevalence of psychiatric morbidity that occur in obese people. Although there are many similarities to those with normal weight, is no need for treatment for actual weight management. People interested in treatment and prevailing just a second. People living with obesity have many physical limitations and also inhabit psychological burdens such as depression, shame, and often low self-esteem as well as lack of interaction. This may cause them to eat more, but studies have shown the prevalence of psychiatric morbidity that occurs in obese people. Although there are many similarities as those of weight, there is no need for treatment to actual weight management. People interested in treatment and prevailing rates of 40 to 60% of psychological factors is confounding. Some cannot separate the biopsychological factors because the metabolic changes that predispose and perpetuate obesity, along with prejudice and the stigma, may cause obese people to withdraw and linger in depression. The biological component. Evidence proposed that human body weight is partly controlled by a group of hormones that communicate to the brain to determine the energy level needed for short or long-term energy needs. Certain hormones control how much food intake and body weight. One hormone is leptin, that is synthesized fatty tissue associated to body fat. Leptin flows directly through the bloodstream to the hypothalamus, which is the feeding center, to increase satiety and avert added food intake. Ghrelin is a growth hormone that affects energy homeostasis that will increase hunger, food intake, and weight gain. The psychological component, mind-body interaction, behavior treatment, self-monitoring, physical activity, and dietary changes. According to the American Psychological Association, genetics play a little role, but overeating during a long period of time and living sedentary lifestyle contribute to obesity. Based on what people think, followed by their actions, determine the outcome. Thus, tend to do what they want regardless of the consequences. If the psychological component is not addressed, these emotions can lead to long-term problems. Stress and depression are the lead change of eating habits because obesity often accompany each other as triggers and influence both factors. The psychological component continues with the cognition, emotion, and motivation. Behavior treatment or lifestyle modification helps by identifying the problem and assists in short-term coping strategies of antecedent events and the consequences of problems those behaviors. Self-monitoring is to record the behavior as they opt to change lifestyle and dietary options by eating more fruits and vegetables, smaller portion sizes, and to avoid sugary sweets, high carb, salty foods, fried fatty foods, and soft drinks, which does not contribute to weight loss, actually. The social component. Here you see a list of a scale that talks about starting from intervention and ending to self-advocacy. The social component describes details of what's needed in dietary based on environment factors and behavior outcomes. The social component also discusses social environment, genetic influences, obesity and promoting behavior and social factors, fostering research integration. Genetics and social environment influence on obesity do interact and have endured many challenges over decades. With new advances and sophistication to molecular technology, biostatics, and effective design strategies for social environment, researchers on obesity is now expanding into interpersonal environments. The social environment, according to Barnett and Casper, goes beyond physical surroundings. Social relationships, cultural settings of how people socially function and interact. These components consist of industrial labor markets, economic, wealth, health, government, race, social inequality, cultural arts, religion, values, and beliefs within the community. The correlation among inverse relationships and social economic status among African American compared to non-African SES indicators were based on occupational status, education, and income, and that lower SES was linked to obesity. Social facilitation of eating shows evidence of total energy intake. Food increases when eating with others. The pathway to obesity deals with environmental choices people make and insight for prevention and treatment. Obesity statistics. This is a chart that determines age and the weight during the time from 1976 to 1980, then to 1988 to 1994, and to 1999 to 2002. And I'm sure that it is still growing rapidly. WHO and NIH recommends obese BMI should be less than 25 to 29.9 kg, losing 10% of initial weight. A general lifestyle change is a good start in achieving weight loss goals. Intervention, educating society beginning in schools to teach children as well as adults about the consequences associated with obesity. Call upon healthcare professionals to assist in reducing biases and stigmas of those who are vulnerable and in desperate need of help regarding obesity. And within another 10 years, obesity will become one of the largest numbers in health problems in the U.S. and in worldwide. Treatment of prevention. Let's just stop obesity through risk factors, childhood, adolescents, and adults, nutritional factors, and policies. Because of increase of prevalence of obesity, programs are needed to ensure prevention is relevant. Prevention programs assess variations of problems associated with obesity, such as calorie and nutrition intake, emotional and social cues that trigger food intake, teaching mothers, beginning with breastfeeding, on to modify child's eating habits early on. Development awareness of risk factors of obesity, especially among children and adolescents, and to have a community discussion with government, with consumer unions, food industry, and mass media to help reduce and regulate non-nutritional food advertising during TV time. Lifestyle changes. As you can see here, we have modification, pharmacotherapy, physical activity, partnership and support group, diet and nutrition activity, cognitive behavior therapy, surgical treatment, self-efficacy, long-term treatment. Lifestyle changes consist of a series of routine developed effective weight loss maintenance. Several intervention programs are available for weight loss. According to Neil.gum, the first option to achieve weight loss and lifestyle modification are based on 3 elements: diet, exercise, and behavior therapy. New developments are on the way. Treatment. Treatment consists of dietary changes, reducing caloric intake, healthy food choices, to feel a sense of fullness, small portion sizes, meal replacement, exercise activity, seeking counseling, support groups. Keep it moving. Prescriptions for weight loss surgery, and then maintenance. The main purpose of people dealing with obesity is to stay healthy and maintain weight loss. Although all weight loss programs work, patients are required to change eating habits and increase physical activity. The Mayo Clinic recommend tools used for treatment: dietary changes of practicing health eating habits. Cutting calories is key to reducing weight loss. A sense of feeling full is a concept of being satisfied and not to feel hungry by using fewer calories. Making healthy choices that limits a certain amount of food, such as carbs and fatty foods. Meal replacement means to replace at least 2 meals or 2 food intakes with a shake or a bar. Exercise and activity is necessary for the body to stay active and keep moving, such as doing daily chores. Behavior program changes will help with lifestyle changes, counseling, and using therapy for intervention or by trained health professionals to assist in coping with stress and anxiety, as well as support groups and weight loss programs. Prescriptions to weight loss medication along with diet and exercise may help along with medical monitoring. Finally, gastric bypass surgery as the last result can quickly assist in losing large amount of weight. Laparoscopic is adjustable gastric banding. Biliopancreatic diversion is a dual with the duodenal switch and gastric sleeve. Others are vagal nerve blockade and ultimately preventing weight regain after obesity. The conclusion: with the prevalence of obesity rapidly growing in our society, and it has been since the last 40 years, several approaches are necessary to slow down the complexity that underlies between gene and environment. Other factors to consider are the psychology of the mind and challenges to change a person's lifestyle gradually by eating healthier foods, smaller portion sizes, and incorporating physical activity, as well as modification of behavior to achieve a successful weight management program. Researchers are advancing the structure of genetics and biology as they battle to decrease mortality and morbidity associated with obesity. Education is key in preparing the problems before it starts. And here is my reference, and I thank you very much for your patience.